Good evening, everyone. I'm Dr. Vaishali Khanduja, a dental surgeon associated with Indian Air Force, and I hope everyone is safe and doing great. Today, we are going to discuss about bad breath, which is also known as halitosis, specifically in children. I would also like to thank BabyChakra for putting me live stream and giving me this platform to raise awareness among people on why dental health is important and how we should maintain it in order to have a good, healthy mouth and overall healthy body. The basic thing that I would also like to share is our body is a reflector of our mouth. Everything that is happening inside our body will be reflected outside into our mouth. हमारी बॉडी में होता हुआ हर एक प्रॉब्लम is associated with something that is visible in our mouth. Bad breath is also one of them. Now, the main question that arises is what exactly is bad breath? बहुत सारे parents walk in करते हैं clinic के अंदर with the basic problem that my child is having bad breath constantly despite of every solution that they have tried. Bad breath is also known as a chronic form of emission of fall outdoor from your mouth, despite of trying brushing and every mouth freshener. बच्चे को 2 बार brush करवा. What might be the reason behind it? We are suspicious and we do not know the reason behind that. The very first one is, of course, कि रात को बच्चे ने सोने से पहले brush नहीं किया and some particles of the food are stuck inside the mouth on which bacteria harbor, grow themselves and release odorous substances. Most commonly, आप में से किसी लोगों ने observe करा हुआ होगा कि बच्चों की tongue अगर हम observe करें, there is a white coating onto the surface of the tongue. What exactly is that? That white coating is basically food particles which get trapped inside the taste buds, and these taste buds allow bacteria to grow onto them and release foul smell. This is one of the major problems. We do not take care of our tongue. How to do that? Have you ever noticed कि जो आपका toothbrush का head होता है, behind that there is a surface which is rough. That surface is used to clean your tongue, to remove the coatings which get accumulated onto your tongue. If your child is experiencing कि उससे gag हो रहा है, gag in the sense he is or she is feeling pukish, then you can use also custom-made tongue scrapers. These tongue scrapers have to allow you to scrape off all those white coatings and will subside down the white odoriferous substances which are being produced inside the mouth. Now, apart from that, this is something, very usual. जो हर किसी को पता होता है कि हाँ बच्चे के मुंह में cavities हैं, he is having gum problems, unclean mouth, these are creating odoriferous substances. What apart from that is important? This is something everyone knows. We need to know and go into the depth of the topic. How you're going to, relate yourself with the bad breath. The main reasons we are going to discuss today, apart from the basic things. Other main reasons are how your child is having dry mouth. If some of you have observed, your child must be sleeping with their mouth open. They're keeping their mouth constantly open while they are sleeping. The reason for that might be something very, very serious. First can be, of course, a very common one. They're having common cold or something, a little kind of congestion inside their nose, which is not allowing them to breathe. That is why they're keeping their mouth open, and as a result, it is getting dehydrated, it is getting dry and allowing bacteria to stay inside it, because our saliva basically acts as a flusher for all the bacteria. It is a natural antibiotic thing, you can say. But sometimes what happens is that a child is having abnormal jaw growths. Those abnormal jaw growth is not allowing your child to sleep and breathe properly simultaneously. For that one particular reason, your child is keeping their mouth open and breathing through their mouth. These things in future can lead to need of braces, orthodontic treatment in medical terms. ब्रेसेस से आपके बच्चे के दांत को एंड जॉ को करेक्टिफाई किया जाता है and then these problems get solved. To prevent these problems, go up to a stage of braces. What you can do is that you can Basically, आप कर क्या सकते हैं? You can visit a dentist early. Visiting a dentist early will create some kind of jaw growth alterations, and these jaw growth alterations can prevent your child from having braces in the future. Apart from jaw, there can also be certain medical conditions. These medical conditions can also be a reason for a child keeping his or her mouth open while sleeping. One of them is enlarged tonsils or adenoids, as you want to say. Enlarged tonsils will create kind of an obstruction while they're trying to sleep. Apart from that, tonsils will also act as a magnet for bacteria. Those bacteria will go and sit onto the tonsils and create a more odoriferous substances, creating a foul smell inside the child's mouth. So it is always best to get these things tested. Now, these are little low things, something which are not majorly serious. As we move ahead, there can also be some major issues that have to be tested. The very first one is most of you must have heard of gestational diabetes. Gestational diabetes is when mothers, when they are pregnant, they develop diabetes during the course of their pregnancy. These kind of pregnancy diabetes can last for a longer period of time. Specifically, this can have an effect when you're having your second child. Your second child is more prone to have diabetes in his or her early stages of life, if not detected at very early stages of gestational diabetes. What happens is, if you're having gestational diabetes, your first child is prevented from having diabetes, though you can also develop diabetes post gestational period of yours. And your second child is definitely 90% suspected to have diabetes. These things go undiagnosed in routine. But if you look at your child's oral cavity and have a smell of his or her breath, you will realize that a child is having little fruity smell inside the breath. These fruity smells can be similar to acetone smell, which you have in your nail polish removers. This smell is a significance of your child having diabetes. So your mouth can give you an early sign of your child having diabetes. These things need to be detected in early stages. Apart from that, kidney disorders, stomach infections, all these are reflected through your mouth. They have a little kind of a pungent odor or specific kind of an odor which you guys will not be able to detect, but a dentist will definitely be able to detect. So you guys need to keep a check on your breath. It's not just about your, oral health hygiene or dental caries which you're having, but it's also about what your body is giving a sign. Your body is giving a sign when you have to seek a medical attention. That is the significance of having a bad breath. Now the question is, what should you really do if a child is having bad breath? The very first thing is start from the basic things. Parents have a tendency that if they have attended a seminar or a lecture where they got to learn about all these things, where they have got to know about all these things, they simply jump onto the larger conclusion. For example, you're attending this seminar, you might simply jump onto the conclusion that mere bacche ka agar bad breath is not getting resolved, it will definitely be something like diabetes. No, hold on. Don't overreact. Don't just overthink. Don't simply jump to the largest situation. All these are just factors which have been evaluated and told to you. What you need to do is start with the basic things. First one is make your child brush twice a day, early morning and before going to bed. Early morning one is still not very significant, but before going to bed is one of the most important thing you should be doing with your kids. Before going to bed, they need to brush properly. They need to scrape off their tongue so that all the loose food particles or the one which are lodged between the teeth are washed away. Make your child develop a habit of flossing. What is flossing? Flossing is basically kind of a dental thread that is used to clean in between the teeth. You should make your child have a habit of that. These things will prevent your child from developing all these cavities and specifically odorous breath. If these things do not help, switch to a little further treatment. Make him have warm salt rinse. What are warm salt rinse? Gungune garam pani mein, you have to add little pinch of salt and make them rinse with that. It's one of the natural homemade antibiotic solution which you guys can use. Not helping? Fine. Further switch to a step. Make your child visit to a dentist. A dentist will be the one who will be evaluating it in most of the specific ways. Get all the cavities filled. Those loose cavities will be like a hole inside your child's teeth and will act a reservoir for food entrapment, and where bacteria would get lodged and produce smell. So what you can do is get them checked by a doctor, by a dentist specifically, who are trained to do all these things, get all the cavities filled, get all the preventive treatment done. And then also, yeah, one important point, keep your child hydrated, well hydrated. A dry mouth, as it has been told to you, is one of the basic problem, basic etiology for causing bad breath. After all the cavities have been filled, get a professional cleaning done. Sometimes what happens is that your mouth is not cleaned thoroughly with your own cleaning. So get it professionally cleaned. That is the best thing. Apart from that, what you can do is how to convince the child to go to a dentist. Never scare away your child with dentist name. You know, you guys have a tendency of scaring away your children with name of a dentist. Like, agar aap ye nahi karogi, we will take you to a dentist. No, don't do that. That way you are spoiling our image and not making us go friendly with your child. Just don't do that. Be a good example to your child. If you are brushing well, the child would brush well. Be a good role model to them. Visit your dentist regularly. Show them that if you are able to take that treatment properly, your child will also be able to take that treatment properly. And that is how you do it. And the next thing is, how will you be able to do that, right? If you're being a good role model, will your child be able to follow that? Yes, he will be able to follow that. Just don't be anxious in front of them. Just be calm when you go to a dentist. Let us handle them. We are trained for that. So the next thing is, when is the right time to visit a dentist? What time should you be able to, have a good evaluation of a dental checkup? The first thing is, you should be visiting a dentist when first teeth of your child appears in their oral cavity. जब बच्चे का पहला दांत निकलता है, तब आपको उस डेंटिस्ट को दिखाना है. That is between 6 to 9 months of age. That is the best time of evaluation of going to a dentist. Now, another question that I have been receiving is, what are the causes of bad breath in children? As I have spoken earlier, the causes of bad breath in children would be either an underlying medical condition such as ENT infection. ENT infection would be ear, nose, or throat infection. These can basically allow the bacteria from the same tract to travel upside to the mucosa of your mouth, of your child's mouth, and produce that bad smell, which is not pleasant at all. Or it can be dry mouth, as it has been discussed earlier, with an underlying etiology of abnormal jaw growth or enlarged tonsils. Enlarged tonsils can be one of them. Get the child's tonsils checked, because childhood age or early age is the time when child is having enlarged tonsils and causing these kind of problems. Apart from that, it is poor oral hygiene. A child having badly coated tongue or any kind of development of fungal infection inside the mouth, that needs to be detected early at an age. And it can also be poorly jaw growth, enlarged tonsils. That's it. These are the major, or it can be some systemic condition, kidney disease, diabetes, stomach infection, liver disease specifically will create these kind of problems. The symptoms of Bad breath. Another question which is raised, how will we get to know a child is having bad breath? Of course, the smell test, you can smell your child's breath early in the morning or somewhere in between the day. Early morning would just be an ideal situation because उस time already बच्चे ने अगर brush करके वो नहीं सोया है तो bad breath आने के chances बढ़ जाते हैं. You should be checking in between the day. When he is having normal movements, drinking water regularly, just keep a check on them. कि कोई bad smell तो नहीं आ रहा when they are talking or when they are yawning specifically, उस time पे आप बहुत easily detect कर सकते हो. बच्चा खुद आपको बोलेगा that in around their school, around their friends, they are complaining कि आपके मुंह से bad breath आ रहा है. Little social distancing that has been developed by them. So that can be another symptom which you should be looking for. Apart from that, also keep a check on their overall body symptoms. अगर वहां पे कोई alteration आ रहा है, any kind of alteration in the bad breath is obvious then. So keep a check, keep an alteration checking on that. Next would be, what would be the treatment? The treatment would be, you can try some kind of mouth fresheners. बच्चों के लिए specific kind of mouth washes are available under some brands which you can use, such as fresh chlor hota hai. There's some fresh substances into that which are having menthol, mint. Or what you can do is ask your child to swallow mint around, swish mint around their mouth. वो मिंट को खाएंगे तो उससे थोड़ा बेटर ब्रेथ आएगा. लिटिल फ्रेश ब्रेथ कैन बी सीन देन. मेक अ हैबिट ऑफ ब्रशिंग twice a day. Stand along them. Don't just make them brush alone. अकेले वो ब्रश नहीं, उनके साइड में खड़ा होके ब्रश करिए. Show them how you have to do it. Show them some YouTube tutorials. Show them how to do that. Apart from that, if all these things are not getting correctified with that, visit a dentist. Get a professional treatment. Professional cleaning करवा सकते हैं. It will remove away all the deposited substances, and then the smell would go down. Apart, when you need to show the doctor, as I said, when the first tooth of the child appears in the oral cavity, the duration would be 6 to 9 months. 6 महीने से लेके 9 महीने के बीच में बच्चे का पहला दूध का दांत आता है, और 6 साल से लेके 12 साल तक बच्चे के परमानेंट दांत आते हैं, जो दूध के दांत टूट के परमानेंट दांत आते हैं. So these stages are the best time to get your child evaluated and checked by a dentist. It's never best to skip a dental visit. So one thing I would like to suggest after post this session or at the end of this session would be, never skip a visit from your dentist. A dentist is your child's friend. Don't be scared of them. If you'll be scared of them, your child would be scared of them. Show them some videos where they're treating children happily. Just make them familiar with dental treatments. And for more such visits, for more such suggestions, you can visit my Instagram handle at the name Dr. Vaishali Khanduja and get all your questions solved then. You can also follow me on BabyChakra by my referral code Vaishali K for more such informations, and of course some complimentary very complimentary treatment protocols which you can do at your home with your child. I hope you all have had a great session, and you can follow me on my BabyChakra using BabyChakra or following my referral code. Thank you so much, guys, for giving me a valuable time, and I really hope you get to learn a lot from this session about your dental health, and you guys will be a little more cautious about your dental health. Thank you so much.